Ever considered what it's like to navigate healthcare when you're part of the deaf community? It's a question that might not have crossed your mind, but it's a daily reality for over 460 million people worldwide living with disabling hearing loss, according to the World Health Organization. This group includes those who are deaf, referring to individuals with severe to profound hearing loss, and those who are deaf, members of distinct cultural and linguistic communities who communicate through sign language. They share common experiences and values, forming a unique global community. Important to note, the term D-deaf does not encompass hard of hearing individuals. These are people who, despite some level of hearing loss, can use auditory devices to process speech. For the deaf, deafness is not a disability to be corrected, but an alternative way of being. It's a unique way of being, but it comes with its share of challenges, especially in healthcare. Imagine trying to communicate your health issues, but the message gets lost in translation. This is a reality for over 460 million people worldwide who live with disabling hearing loss and are part of the D-deaf community. Health inequities are a stark challenge for this community, a challenge that often goes unnoticed. They face significant barriers in accessing and receiving high-quality healthcare, resulting in less than optimal health outcomes. Picture the anxiety of being in a medical environment, with its complex jargon and fast-paced conversations, and then having to navigate it without hearing. These difficulties are further compounded by a lack of effective communication with health professionals. Many don't have access to sign language interpreters, making even the most basic exchanges a daunting task. Additionally, healthcare professionals often lack the needed training to communicate in a culturally appropriate way with D-deaf individuals. This gap in communication extends well beyond the healthcare setting. It impacts the health literacy of D-deaf individuals who face limited access to hearing-based mass media, ambient conversations, and public health messaging. These key sources of information, designed for the hearing world, are often inaccessible or poorly adapted to the needs of the deaf community. These unseen barriers create a world where the deaf community is often left behind. The struggle for health equity is not just about medical treatments, it's about making sure everyone can understand and be understood. In a world designed for the hearing, the deaf community often gets left behind. The impact of these barriers, a health gap that's more than just a statistic. When we examine the health outcomes, we find that D-deaf individuals often face a harsher reality than the general hearing population. These challenges are not just limited to physical health, but span the spectrum of well-being. Take chronic diseases, for instance. D-deaf individuals are more likely to encounter conditions like hypertension and diabetes in their lifetime. Mental health is another crucial area of concern. Rates of anxiety and depression are notably higher in the deaf community, and tragically, the risk of suicide is also elevated compared to the general population. Beyond these measurable impacts, there's a subjective element that's equally important. Deaf people often perceive their own health to be worse than that of the general hearing population. It's not just about the numbers, it's about the lived reality of individuals. It's a health crisis that's hidden in plain sight. So, what can we do to bridge this health gap for the deaf community? As we delve further into this conversation, we find rays of hope in the growing body of literature focusing on potential solutions to these inequities. Around the world, dedicated research teams are tirelessly working on interventions aimed at reducing the health disparities faced by the deaf community. One of these key interventions is a concentrated effort to improve health literacy among D-deaf individuals. By ensuring better access to health information, these initiatives aim to empower the D-deaf community to make informed health decisions. Additionally, the development of specialized healthcare facilities that cater to the unique needs of the D-deaf community is another promising stride towards equality. These facilities are designed with a deeper understanding of D-deaf culture and communication needs, fostering a more inclusive and respectful healthcare environment. The road to equitable healthcare for the D-deaf community has started, but it's a journey we must all take part in. Now that you know, it's time to act. The issues faced by the D-deaf community are significant but not insurmountable. By learning more about these challenges and becoming part of the solution, we can make a difference. Whether it's advocating for better access to sign language interpreters in healthcare settings or supporting research into specialized healthcare facilities, your involvement matters. This is about more than just healthcare. It's about equality, understanding, and respect. Together, we can make healthcare accessible for everyone, regardless of their hearing ability.